Hello my fellow VSGers, this is Joe Saint along with Frankensleeve bringing you another quick fact, frequently asked questions. And this frequently asked question is, what kind of pre-op tests do I have to take before having weight loss surgery? And there were 4 main tests that I had to have done before they would approve me for surgery. I had to have my blood work done. They drew about 9 vials of blood. And then just before surgery they drew another 9 vials of blood the day before surgery. It turns out that, at least in Texas, if you have blood work done more than 3 days before surgery, those tests are no longer valid and you have to have your blood work done all over again. So I did have to go back in to the hospital and have them draw my blood again so they could have valid test results. The second thing I had to have done was a abdominal ultrasound, which was pretty much the same thing that they do for the pregnant ladies. They ran this little ultrasound device over my stomach and made sure that everything looked okay inside my stomach and my intestines and my organs. Then they had to perform a chest x-ray, and this was a standard x-ray. Went in, they took, I think, 3 views, one from the front and one from each side, and maybe one from the back. I forgot now, it's been too many months ago. And the final test a lot of people dread is called the EGD test, which is where they put you into the hospital and they put you under anesthesia and they run a camera down your throat. For me, there was nothing to the EGD test. They wheeled me into the operating room. They put a bite guard in my mouth, and the bite guard had a opening in it about the size of my thumb, and that allowed them to push the camera down my throat. They knocked me out with this. They said the same stuff that Michael Jackson would be given to go to sleep, and the doctor walked over to me and he said, okay, you may feel some burning sensation in your hand where the IV was stuck in. They were going to inject the anesthesia into that same port. I never felt the injection go in. I simply blinked my eyes. At least I thought I had blinked my eyes. I blinked, opened my eyes back up, and I noticed the bite guard was laying on the table next to me, and I reached over and put the bite guard back in my mouth, and all of a sudden all the doctors and the nurses started laughing at me, and I couldn't figure out why. But it turned out the test was over. It was that quick. There was no drifting off to sleep. There's no sensation of getting sleepier. It's like you close your eyes, you open your eyes, the test is done. So that was some good knockout juice. I wish they could have given it to me for the main surgery, but for some reason, for longer procedures or for some medical reason, they do not use that same type of anesthetic for the full weight loss surgery procedure. There was one other test I had to take, but that was a psychological test that had nothing to do with blood drawing or x-rays, and I'll explain that one in a future video. So, this is Joe Saint and Frankensleeve signing off from VSG land. And keep pimping that sleeve.